health disparities. How do we achieve justice? What's justice versus equality?
The first thing is we need to acknowledge. The great thing about what has happened and how clinical trials have evolved is because there was acknowledgement of the wrongs and there was acknowledgement of the issues in the system. And that was through the Belmont report, as well as other reports. And so I think the first step for us to be able to actually do anything about these health disparities, we need to first acknowledge where the issues exist, and then we can create solutions. But acknowledgement is the first step in being able to tackle the problem of health disparities.
I think I'll add that, a key step to this is really, I think, as a healthcare system, acknowledging that we don't have all the answers. And I sort of both say this and practice this even when I'm on clinical. I often rely on my patients and more broadly on the communities that are facing these challenges for solutions, and really being collaborative about the way we go about it, and acknowledging the fact that we as a healthcare system don't have all the answers. And there's a lot of great creative solutions out there in our community that have that may have already been developed, and then in some instances we already know the answers of what we need to do, and it's a matter of either policy taking role or using concepts from implementation science to kind of implement the right thing. But I think ultimately for me it's really about going back to the communities that we're trying to help and trying to engage with, and really working collaboratively with them to come up with a lot of these solutions to make sure it's actually solving the issues that they're facing, rather than sort of coming in and saying here's what we're going to do and here's what we're going to solve this. I think this kind of community-based approach can really address a lot of the health disparities that we're seeing.
I would agree as well. I think Dr. Abdulai, as you mentioned, sort of the acknowledgement of the disparities. COVID has placed that sort of a magnifying glass on it. We knew that the disparities were there, but now they're really like in the forefront, sort of in our face. And then Dr. Rodriguez, you were mentioning how we need to work with, with community members to come up with the solutions. And I totally agree. I think that, on an individual level, we should empower patients, about and educate them about, different, health conditions, so that they know how to advocate for themselves. And then when we look at solutions, we have to, involve patients in offering up those solutions. And we have to work together and sort of transcend that sort of individual level to work collectively to advocate for policy reform. We have to elect, government officials that are going to, create policies that eliminate these, inequities. The elimination of the inequities have to be in the forefront, and we have to involve patients as well as key stakeholders to come up with those solutions and really have the policies be reformed, and work with patient advocacy groups like AAFA to sort of really push that agenda forward. And I think, we can really make a difference with combining those initiatives.
I thought you guys did a really good job, explaining really what we need to do in regards to eliminating or abolishing disparities. And I think what I could add is really, at the end of the day, the solution is the principle of justice. Because, usually, you'll bring up the principle of equality, like we want equality, but really that's insufficient, because that's really just the equal distribution of rights and opportunity, and really that's, again, not enough. And equity, is a good goal as well, because with that, we're distributing, those rights and opportunities based on the need. But justice just takes it to the level of we're really getting rid of that foundational issue or those structural issues, through, typically through, different policies and kind of legislative type of matters to really get at that underlying issue, so that we could really have that fair distribution of rights and opportunities. And I think the way we have to think about this, because sometimes when you look at it and through that lens, it can really feel overwhelming, like, oh my God, how are we going to fix this problem? It's so huge, because, we see disparities not just in asthma and allergy issues, we see it across every single health condition. So, it seems like a lot, but I think, we have to really look at this like a all hands on deck approach. It's going to be, what are we doing as individuals in our own local communities? What are we doing federally? What are different institutions doing? Like, for example, academic medical centers, what are schools doing? So I think everyone has to feel like they have skin in the game, to be able to really think about what changes they can make. And I think with that we'll be able to really lead to, eliminating disparities across the board for everything.